Welcome everybody to this webinar on access to prescribed medications for rural, remote, and underserviced populations. I'd like to welcome Jill Hardy from the College of Pharmacists of Manitoba, who is joining me here in this presentation.
Thank you very much. So we'll start out with some of the objectives of today's webinar. By the end of the session, you'll be able to evaluate the limits and criteria within this practice direction, find information on the practice direction on your respective college website, and learn to appreciate the practice expectations for supplying medications in rural, remote, and underserviced populations.
Okay, I'd like to let everybody know that this practice direction is a joint statement developed through a process of interprofessional collaboration with a number of our regulatory colleagues, including the College of Licensed Practical Nurses of Manitoba, the College of Registered Psychiatric Nurses of Manitoba, the College of Physicians and Surgeons of Manitoba, as well as the College of Pharmacists of Manitoba, and the College of Registered Nurses of Manitoba.
So to start out, we know that populations are at risk for potentially harmful delays in care because of barriers to timely access to services in rural and remote regions. Interprofessional collaboration supports safe client care in situations where supplying medications is necessary. All healthcare professionals have a role in patient care and safe client care, and at times and in certain locations, not all healthcare professionals are accessible. This practice direction applies to health professionals working with rural, remote, or underserviced populations where there is a client-centered need to provide a short-term supply of medications. The client has a reasonable likelihood of experiencing harmful delays in care. A pharmacist is not readily available in a time frame of the client's healthcare visit. The facility has a safe, appropriate drug storage requirements such as refrigeration and secure storage. A pharmacist can review the prescribed medication and enter it into DPIN, the Drug Program Information Network in Manitoba, within 48 hours after the medication was supplied. And consultation occurs between nurses and the prescriber before supplying drugs covered by the Federal Controlled Drugs and Substances Act. This practice direction does not include practice settings that are not rural, remote, and underserviced. For example, this does not apply to urban settings. It does not apply when a pharmacist is available or accessible to the client, when the pharmacist is preferred by the client, when repackaging of the medication is necessary before supplying to the client, when compounding of the medication is necessary before the medication can be provided to the client, when the client did not obtain a timely renewal for an ongoing prescription, unless it is a situation that it is an emergency where the client, where the healthcare provider determines there is a greater health risk to the client if they do not receive the medication, and the medication requires an M3P prescription.
Thank you, Jill. So in looking at applying this practice direction, we know that the pharmacist, the nurses, and in this situation, nurses refers to registered nurses, licensed practical nurses, or registered psychiatric nurses. Or so prescribers can include any of the prescribers, such as physicians, registered nurse practitioners, or extended practice pharmacists. So prescribers, nurses, and pharmacists all have practice expectations. And to apply this practice direction, everyone has these practice expectations. We expect that they would collaborate and communicate with other healthcare providers in order to meet the client's healthcare needs. And interprofessional collaboration needs to occur to develop a clinical decision tool. And the clinical decision tool needs to have a client-centered focus, evidence-informed practice, interdisciplinary input, annual review and evaluations, so indications and contraindications for the supplying of the medications, indications for consultation with other healthcare providers as necessary, the in-scope and out-of-scope provisions for supplying of the medications, and employer approval.
So I'm going to speak a little bit about pharmacist practice expectations. So within this joint statement and practice direction, the pharmacist must enter the following on the medication label before supplying to the site: the drug name, manufacturer identification, the drug dosage, route, strength, and quantity, the date the drug was prepared, a lot number, as well as a drug expiry date, the pharmacy names, right, where the medication was packaged, the location, name, address, and phone number where the medication was stocked, directions for use, and other information that's appropriate or specific to the medication, as well as the pharmacist's initials who checked off on the preparation. Upon receipt of the prescription, the pharmacist must review the prescription for client-specific care, such as drug interactions and other safety considerations. Enter the medication into DPIN within 48 hours, and notify the nurse when the remainder of the prescribed medication is sent to the client.
So looking further beyond the pharmacist's practice expectations and everybody's practice expectations, the nurse also has further practice expectations. And we would expect that the nurse must competently manage the client situation, including use of the clinical decision tool that was developed interprofessionally. The nurse is also expected to review the client's medication history, do an assessment of the presenting complaint or concern that the client brings, check the client's current medication list, including looking at DPIN where it is available to the nurse, reviewing allergies or potential adverse drug reactions and contraindications for any medications that may be prescribed, determining the medication's expiry date on any starter pack that may be supplied. The nurse would also be expected to enter the client's name, the prescriber name, the date, the nurse initials on the medication label on the starter pack. The nurse is expected to provide any client teaching that is necessary and supply the starter pack directly to the client or to their representative. And finally, of course, to plan for follow-up care. So those are all expectations of the nurse within the client's situation. Additional expectations of the nurse is to do an assessment with the client regarding supplying of medications, including risk to the client's health if the medication is not supplied at that point of care, wait time for the prescription pickup or delivery, including impact of the distance, extreme weather, and or other unusual factors if the medication were not to be supplied at that point of care, and to also do an assessment of any potential adverse effects of the medication if the medication were to be supplied. The nurse, of course, is also expected to document as per all of the applicable practice expectation and to notify both the prescriber and the pharmacist of the starter pack that was supplied. Now the prescriber, and that of course, as I've mentioned, includes the any prescriber, such as a nurse practitioner, a physician, or an extended practice pharmacist. And they also have expectations to meet any necessary applicable standards in prescribing and to sign the prescription and send to the pharmacy within 24 hours of prescribing the medication. This next slide provides a visual representation of the workflow and is available on the practice direction, which is available on the websites of the colleges who put this practice direction together. And so it's a visual representation of the steps that the nurse, the pharmacist, the prescriber would take in applying this practice direction. So I would refer you to have a look at this workflow because it can guide you through the steps. So let's turn our attention now to some practice scenarios.
Okay. Let's start off with practice scenario number 1. So at 8 o'clock p.m. on Saturday, Mr. Smith presented to his remote health center with a complaint of dysuria, urinary urgency, and frequency over the past 6 days. The LPN obtains a health history, performs a health assessment, and determines that he is symptomatic of a urinary tract infection. As per the bacteriuria clinical decision tool, the LPN asks Mr. Smith to provide a midstream urine sample. Prior to processing the urine sample for the lab, the LPN notes the urine is foul-smelling, dark amber, and cloudy while performing a urine dipstick test. The test is positive for nitrates, hematuria, traces, and leukocyte esterase, indicating a urinary infection. There is no open pharmacy in the community or in the nearby area, nor is there a prescriber on site until next week. So what else is expected of the LPN in this situation?
Well, the LPN would be expected to contact the facility's on-call prescriber to discuss the assessment results. In this situation, in consultation with the LPN, the prescriber may decide and does decide to prescribe nitrofurantoin, 100 milligrams PO BID for 5 days. Now, because there is no open pharmacy in the area, the LPN would be able to supply a starter pack of this medication, provided that they have put in place a system for the starter pack to be supplied to this remote health center, and it is stored safely at the health center. The LPN would need to check the expiry date of the medication and the labels to see that the label was entered properly, and would also be expected to enter some further information, such as the client's name, the prescriber's name, the date, and the nurse's initials. Prior to supplying the medication to Mr. Smith, the LPN would be expected to provide client teaching on the treatment and the medications to be provided, and to instruct Mr. Smith on any necessary follow-up care at that health center. The LPN would also be expected to notify the pharmacy of the starter pack that was supplied, and to document accordingly, ensuring to include the date, drug name, strength, dose, lot number, quantity supplied, and length of medication therapy, as well as any client instructions provided.
Great, thank you, Diana. And what would be expected of the prescriber?
Well, the prescriber would be expected to collaborate with the LPN to decide any appropriate treatment, and if a prescription was warranted, which in this case it was. The prescriber would be expected to consult with the pharmacist if necessary, and if prescribing, and upon prescribing, the prescriber would be expected to sign and send a prescription to the pharmacy within 24 hours of prescribing this medication. Now, the pharmacist also has expectations, so what would the pharmacist be expected to do?
So the pharmacist is expected to review the prescription and enter it into DPIN within 24 hours. That prescription review would consist of ensuring dosage is adequate, reviewing interactions, things like that. So standards of practice for pharmacists. The pharmacist would also be required to send out the balance of the prescription and provide counseling to the patient. The pharmacist would also be required to inform the nurse that the balance of the medication was provided to the client.
So would the expectation be within 24, or would it be within 48 hours upon receipt of the prescription?
My apology, it would be within 48 hours of receipt.
Yeah, perfect. So let's take a look at a second practice scenario.
Great, so within this practice scenario, Mr. June attended the ER in a small rural community. He was assessed, prescribed anti-anxiety medication to start immediately, and was referred for psychiatric follow-up. The RPN, working as a psychiatric emergency nurse, or PEN, at this ER, provided teaching on anxiety reduction techniques and appropriate use of this medication. No pharmacies in the area were open on this day, so the PEN provided Mr. June a starter pack of the anti-anxiety medication, and the ER physician provided a prescription for the remainder of the anti-anxiety medication.
So looking at this practice scenario, do you think it is within scope of this practice direction?
I think it is, yes. The reasons for that is that this is a rural community. The patient doesn't have easy access to a pharmacist. And at this point in time, anyhow, the patient has a reasonable likelihood of experiencing harm if the medication wasn't supplied. And the anti-anxiety medication in this situation was not a CDSA medication. It is also expected that the ER has a safe, appropriate storage for the starter pack. Plus, it's necessary for the ER to have a collaborative relationship with the pharmacy so that the pharmacist can review the prescribed medication and enter it into DPIN within 48 hours of receipt. In this situation, what is expected of the pen?
Well, the pen has a number of expectations. So we would expect the pen to use a clinical decision tool that was developed for this ER. The pen would also be expected to review the client's medication history, do an assessment with the client of the presenting concern, to review allergies, potential adverse drug reactions, and contraindications for any medications that may be or were prescribed. Before supplying the medication, of course, to determine the medication's expiry date, and then enter, again, the client's name, the prescriber's name, date, and nurse's initials on the medication label, provide the client teaching, supply the medications directly to the client, plan for follow-up care, and discuss that with the client, where the client will be able to access the follow-up care, and then inform the pharmacy of the amount of medication that was supplied to the client. So let's take a look at a third scenario. And in this case, we have labeled it as an out-of-scope scenario. So Tuesday morning, we have Miss Barker, who was bit by a dog, and she went to her local health center, which is located about 10 kilometers from an urban center. And she went there to seek treatment for the dog bite. Now at this urban center, at this local health center, that is, there was no physician or nurse practitioner or pharmacist on site. There was an RN, and the RN did provide a thorough assessment of Ms. Barker's the dog bite. The RN assessed that Ms. Barker was in significant pain, so she provided her with a 4-day starter pack of Tylenol number 3. And she advised Ms. Barker to return to the clinic in 3 days when a physician would be on site. The RN documented the assessment and provision of the starter pack in the client's chart. So the joint practice statement on rural, remote, underserved populations, this practice direction, why would this not apply in this situation?
Well, there are a few reasons why this wouldn't apply. Firstly, the community mentioned here is close to an urban center, and as such, this community would not be considered a remote or underserviced area. Secondly, prior to supplying Tylenol 3, the RN must consult with a prescriber because Tylenol 3 is a drug covered by the federal CDSA, Controlled Drugs and Substances Act. The RN in this situation did not use a clinical decision tool, nor did she notify the prescriber and pharmacist of the medication supplied, including date, drug name, strength, dose, lot number, and quantity supplied, length of medication therapy, client instructions, nurse signature, and title. Additionally, a prescription is required and must be signed by the prescriber within 24 hours and provided to the pharmacist for entry into DPIN within 48 hours. So those weren't accomplished in this situation.
Right. And it would be any of those that would make it out of scope. So we had a number, but really any one of those would lead to it being out of scope of this practice direction.
Absolutely, yes.
Yeah. Great. So this brings us towards the end of our webinar on this practice direction. And of course, we have any questions that you may come up with. Certainly contact us at any of our respective colleges. And you can access the practice direction itself, which we have reviewed in this webinar, on the websites which we have listed here, the 5 colleges. So I want to end this webinar by thanking you, Jill, for joining me, and thanking everybody for taking the time to listen and apply this practice direction.
Oh, well, thank you very much.